Thank you everybody for coming in. My name is Dr. Mark Gabriel. Welcome to Advanced Wellness Center. Today's lecture we're going to be talking about peripheral neuropathy and how we can actually detect what peripheral neuropathy is. So some of us may suffer from one or more of these types of symptoms, and these symptoms can be including numbness, tingling in the hands or the feet. It can include pins, needles, feeling, loss of balance, loss of sensation in the hands or the feet, pain in the hands or the feet. This could be loss of sensation, like we said, or it could include some kind of change in temperature, or it can result from diabetic neuropathy. So some of these symptoms too, over a long period of time, can result in muscle wasting. So the muscles become atrophied. So you start losing some kind of a mass in this amount of muscles. It can lead to organ dysfunction. It can lead to gland dysfunction. It can lead to digestive problems, blood pressure problems, and sexual dysfunction over a long period of time. Just because over a long time, what happens is that you start losing your ability to perform a lot of activities. You lose your muscles, and then with the gland dysfunction, you start losing weight or you increase the weight gain. And based on that, you result in digestive problems, and that can lead again to blood pressure problems. And over a long period of time, with a lot of psychosocial problems, you start having some depression and sexual dysfunction. So, looking at these symptoms again, so in the feet, they may appear like pins on the feet. You can feel like you're standing on some kind of a cactus, or you can feel like there's some kind of needle feeling going on. So how does this look like? Sometimes over a long period of time with the muscle weakness, you start having a toe drop. So start trying to pick your leg up or try to pick your feet up, and that would actually start dragging your feet. So there's some kind of weakness there that you can hold your whole foot together. So this comes again, might be coming from the ankle, or it can happen due to loss of nerve, or it can happen because there's some kind of a problem going on in the low back. So in the upper extremities or in the hands, it's going to be some type of a similar symptoms. So you can start having some kind of pain here, or numbness, or it can happen with weakness in the hands, one or both of them. So these symptoms can happen at night, it can happen in one hand or both hands. And then it could happen because there's some kind of an entrapment or dysfunction going on in the wrist, the elbow, the shoulder, or it's happening from the neck. And then it radiates down. So that's what we call radiating pain. So, are you alone? You're not alone. So the CDC, or the Center of Disease Control, estimated about 20 million patients suffer from peripheral neuropathy every year. So that's 1 in 15 people in the US. So it's a very common disease or a very common condition to suffer from. 60-70% of diabetic patients have nervous system problems or nervous system damage. That's based on National Diabetic Statistics fact sheet. 1 in 6 people will develop an ulcer on their foot. That's from the diabetes. 1 in 6 people with an ulcer will require amputation at one point in their lives. So there's about 90,000 amputations yearly in the US just because of diabetes alone. So all this is happening because there's some kind of dysfunction or some kind of a problem going on with the nerve. So what are nerves? Okay, nerves are actually a group of neurons. They're attached together by dendrites. So let's not worry about the science. Let's look at the neuron. Neuron is just a nerve cell. So a nerve cell would look like that. So this is pretty much where it starts. This is where it's going to end. And this is how the nerve can send signals to each other. So, and this is how the brain can send signals to the rest of the body, back and forth. So how these signals are actually transferred? They get transferred around something here called myelin. So the signals get transferred from one side to the other, and they just keep jumping around that way. If you start losing any kind of myelin here, then you start having a lot of slowness going on in the signals that are going from the brain to the rest of the body. So again, so the nerves are the pathway, pretty much going all the way to the brain, and that way you can start seeing things, you feel things with your hands, you start doing activities with your hands, feet, And if there's any kind of problem going on here, again, with the myelin, that's when you start losing that function again. So, if there's any kind of problem going on here, that's when all these signals stop, and then they don't continue. So, trying to go back to the big picture again, if this is how the myelin sheath should be surrounding that nerve cell, and then the signals should be jumping around. If there's any kind of a problem here, any kind of severing going on in the nerve, whether it's in the neck, the lower back, or in the hands or the feet, that's when you start having some kind of a problem, numbness, tingling, pins and needle feeling, or weakness after a long time. So, what are the causes to all these problems? So, it could be because of carpal tunnel, and carpal tunnel is going to be any kind of entrapment going on here at the wrist. It could be because of diabetes, disc herniation, whiplash injuries, tarsal tunnel syndrome. And tarsal tunnel is the same type of carpal tunnel, but it happens in the ankle. And multiple sclerosis, sometimes rheumatoid arthritis, advanced HIV, thyroid dysfunction, which is the gland dysfunction, or any type of other trauma. So we're going to talk about disc herniations here and how whiplash injury can cause some disc herniation. So if there's any kind of, let's say if you get in an accident and your head goes back, all the way back, that's called extension, and it goes all the way forward, that can cause some kind of trauma to the soft tissue and to the disc itself. So the disc should be between these two bones in here. These, let's say these are the cervical bones, and the disc is going to be right in between them. If there is any kind of trauma happens to them, the disc actually presses right here on the nerve, and that's where the entrapment happens, and you start feeling all of these ridiculous symptoms or numbness and tingling in your hands, whether it's in the cervical spine or in the neck, or if it's a low back, you start feeling in the legs. So, how do we diagnose this? So if you or anybody that you know actually have any type of these symptoms, then you should refer or you go back to your primary care physician. Slow down the activities that you feel increase this type of symptoms. So let's say if you do a lot of work with your hands and then you start feeling a lot of numbness and tingling, slow down this type of work or stop it. And your doctor should be able to take care of these symptoms right away or refer you to some specialist that can actually take care of it. So usually if you have some type of injury to the neck or the low back, what would happen is that these symptoms would happen or start appearing after about 3 to 4 weeks after the injury. And you should take care of it right away. So again, with the diagnosis, what we can do is that we can take x-rays, we can do MRIs, or we can do nerve conduction studies. With the nerve conduction studies, we'll be able to tell where the dysfunction is coming from. Is it coming from the wrists or the ankles? Is it coming from the knees or the elbows? Or is it coming from the neck or the low back? And that way we can treat this problem accordingly based on the type of dysfunction that's happening. So what can we do about these problems here? We can do chiropractic care, we can do herbal medicine, we can do acupuncture, we can do injections, and then if we cannot solve all of these problems with alternative care, we can actually refer out for surgery if necessary. So the chiropractic treatment that we do here includes spinal manipulation for joint dysfunction, and that way we can restore that alignment of the cervical spine or the low back and be able to cure any kind of soft tissue or the disc right in the middle. Or we can do muscle relaxation, we can do massage therapy, or we can do a lot of electric therapy that would be able to take care and relax the muscles that are covering the neck or the low back. We can do McKenzie exercises. The McKenzie exercises help to actually restore the position of the disc and be able to take care of any kind of problem that happened to the disc in the past. And we can do stabilization again, be able to reverse that process and be able to manage the pain of the problem and take care of it so you can be able to function normally later on. We do kinesia taping as well. You saw in the Olympics they had all kinds of tapes all over the shoulders with the athletes, so we do the same type of treatment here. and we can provide you with ergonomics and nutritional advice. A lot of B12, if you take B12, that should actually take care of restore nerve function and increasing that nerve supply. And with the ergonomic advice, if you have any kind of problem, then we should be able to take care of it to minimize that type of pain. So with the spinal manipulation, again, it's a very common technique, and it returns the joint back to its full mobility and position, and it should be very effective in the first 6 weeks of injury. So if you have any type of injury, then you should report to your primary care physician, and that way we can take care of it right away without having to delay that process and deal with the consequences later on. And then we combine this with a lot of therapies here, be able to do a lot of exercise, we'll be able to do a lot of massage therapy, and that way we can actually combine all these therapies to get you better. These are the references that I have. And then if you have any questions, feel free to give us a call and check out our website here. Any questions?
If the injury is, or if the nerves are damaged because of degenerative changes, will chiropractic care and like exercise therapy help for that, or is that required?
It'll be help to manage that problem, yes, and be able to function based on that.
And then if it's any kind of injury, will the nerves will repair themselves once they're released from whatever is causing them to?
This will be a long process. What we would do is to actually be able to get you to function normally without technically repairing the nerve, but just to be able to function normally without having any pain.
Is it possible for the symptoms to show up like months after the onset of an injury?
Yes. It happens usually 3 to 4 weeks after the injury, but then it continues for about 6 to 12 months, and sometimes it continues on for years. But usually it appears at about 3 to 4 weeks after the injury.
And then for most people, if it's like a whiplash injury, what's like their prognosis for being able for a complete recovery?
With chiropractic care, it's about 94% recovery. You're welcome. Any other questions?
If you don't, some of these symptoms where you talk about numbness in the hands, say that you don't have numbness in the hands, but you have the same feeling on your feet. Is that the same treatment? Is that the same idea here?
It's the same concept pretty much. So if you're worried about whether the symptoms are in your feet or in your hands, we'll be able to diagnose that and then treat it accordingly. Any other questions? Well, thank you very much. I appreciate it.
All right.